Hello and welcome or welcome back to the COVID Advocacy Exchange. We are thrilled to be back together today. What you are a part of right now in this moment has been co-created by individuals and organizations from around the world. We started this not really knowing what we were getting into as COVID was really starting to affect us in the world and in very different ways. This advocacy exchange has been co-created by advocates, by industry, by healthcare providers, researchers, patients, and caregivers, and so many experts from around the world. In total, we've had now 80 advocacy organizations contribute and create the resources that are a part of this site. We encourage you to check it out anytime. It's open 24/7. And we're also very proud now to have had 15,000 people from 81 countries access these resources to see what we're creating. For us and our team, we truly feel like we're a part of something bigger than ourselves. Our first 10 sessions, which we've finished now and they're all available in the recorded versions, were created by the issues that we've been dealing with going through COVID. We encourage you to check them out. They're packed full of experts and insights talking about the issues that we're dealing with around the world. Today's session is now focused on getting back to care by putting patients first. And based on your feedback, we're changing the format now. And so we will be moving into breakouts where you will have a chance to interact with your peers, with others, to listen and to have your voice heard. Our goal for today is to be present together, not necessarily perfect. So if it takes us a few seconds to move everybody into the breakout rooms, or there's any other technical hurdles that pop up, please bear with us. We've got an expert team that's going to get us through it. And we promise this time interacting with each other will absolutely be worth it. And now I have the honor to introduce someone that I respect tremendously. Dr. Nick Botwood is currently the head of U.S. Medical Affairs for Bristol Myers Squibb. He is also the interim head of oncology development. Nick has a lot on his mind, as do all of us, putting patient safety first while also ensuring that new treatment and new medicines development don't stop because of COVID. The issues that we face as patients and caregivers don't go away, and so we can't pause to stop the progress that we are all making together. With that, please help me welcome Nick to start our session. Thank you.
Thank you so much, Dave, for the warm welcome and introduction. And I am really so grateful for the long-standing partnership we've had with you and with GRIT colleagues, and for your partnership in creating the COVID Advocacy Exchange. I thought it might be helpful actually just to begin by overviewing some of the COVID Advocacy Exchange activities so far. We've actually continued to witness and hear how this platform has been a really helpful resource for patient advocates throughout this, what can only be described as an extremely challenging year, offering a venue to share resources and collaborate on really important issues which are facing the community today. Clearly things that are impacting clinical trials, things like telemedicine, access to care, and of course, mental health. We're just thrilled to keep that conversation going. So, thanks to all of you for joining us today. Today's session will focus on putting patients first, focusing on how their lived experiences and insights can help inform better care and management of patients. You'll see over the next few months, our sessions will focus on a number of topics: getting back to work by putting employees as patients first, taking action to correct health inequities. It's an incredibly important topic that we'll be coming back to look at, and learning from real examples of advocacy already in action, amongst many other things. A lot of these topics were, of course, developed based on suggestions from global advocates about the issues that are most important to you right now. Together, we'll have more than 15,000 people from 81 countries who have now visited the platform. This represents a mix of advocates, of course, patients, their caregivers, healthcare providers, and fellow industry members like myself. If today's your first session, we're so glad you've come and joined us. You can actually find recordings, as you heard in the intro, of our previous 10 sessions available on the website. And I really encourage you to spend some time watching those that are meaningful for you. In addition, there's some excellent on-demand content available on the platform, including free resources you can download from more than 50 patient advocacy groups. So let me turn to the topic for today a little bit and share some insights with you about state of returning to care. I mean, as stated recently in the New England Journal of Medicine, the COVID pandemic is clearly delaying the many life-saving preventative screening for millions of patients. And there's no doubt that this will carry future implications for our healthcare systems around the world. For me, as a drug developer and for somebody who's very invested in the appropriate and effective use of medicines, the impact of COVID has really been extremely extensive. We have had to be incredibly careful in our clinical trial practices. Number one, and most importantly, of course, to make sure that patients are safe and that we understand what the implications of the COVID-19 virus are on patients entering into our clinical trials. Wherever possible, we've really tried to make sure that patients can avoid coming into the healthcare where they need to for a clinical trial process, and where we're able to conduct measures at home outside of a hospital setting and reducing potential risk of exposure. That's something we've really been keen to do wherever we've been able to do it. And the other thing that we feel a very strong accountability for is that we preserve and maintain the integrity of our trials such that when they read out, we can be absolutely confident that the results represent the truth, and we can represent these at health authorities and hopefully bring new medicines to patients that so desperately need them. Because what we really don't want to do is allow COVID to impact the cycle of innovation and the opportunity for us to bring new medicines to patients that desperately need them. And so all of these things have been very much on our minds as we've been going through this period. We also know, actually, from the Kaiser Family Foundation, that nearly half of adults, so 48% in fact in the US, say someone in their household has postponed or skipped medical care due to the pandemic. And so we're very conscious of that and what that may mean for healthcare moving forwards. We've certainly been looking at our treatment practices and schedules of medicines and trying to support patients by doing, for example, extended treatment periods where our drugs that are often given every 2 weeks can be given every 4 weeks or even every 6 weeks. That's something we've been looking at, so that patients who feel that they may be at risk of coming into a hospital or practice center can actually be treated more effectively at home. Likewise, patients who need to be screened before starting on a treatment or starting on a clinical trial can be managed more safely and more effectively at home. These are things we've been looking at, both in terms of how our medicines are used, but also how we conduct our clinical research across all of our therapy areas. So this is going to be some of the topics today. I'm sure you have much broader experience. We're dying to hear from you, the impact that you think that the COVID has had, and frankly, how we return to normal. I'm actually quite excited to have seen a return after the initial delays to enrollment in clinical trials. We actually put a pause on the opening of many new sites in our clinical trial facilities when COVID first hit, to understand what the implications of that may be, both for patients, of course, and their safety, but also on clinical trial data. We've made an awful lot of progress with that, with the help of patients, families, and caregivers. And I'm very happy to say, I think we're getting back on the track and have adapted to get patients back into trials to make sure we're collecting data in effective and robust ways, and that ultimately we'll be able to represent the outcome of trials in a robust and reliable way. So I'm encouraged to see some returning to normalcy, despite the fact we're still living through this pandemic. But we would love to hear of your experiences and things that we could continue to do and do better. So as was said at the beginning, today will be a little bit different than some of our previous sessions. Rather than the panel, we have the opportunity today to split into several breakout rooms, which will be led by facilitators. And we're going to discuss today's topics and are really around getting back to care and the patient experience. We'll have about an hour for those breakout discussions, and then we'll be reconvening in this main virtual hall together to share some of the key themes. So some of you, I think, will be nominated to represent your teams and be spokespeople on behalf of the breakouts, themes that emerge during those discussions. We really invite you to participate in whatever capacity you feel most comfortable. So please take advantage of the chat function or polls today if you prefer to have your views represented in that way. As an advocacy community, we can use this opportunity to have a really candid discussion about the biggest challenges being faced by patients today in healthcare and how we can collaborate together to address inequalities and areas for improvement. Let's all pull from the lessons learned during this year. I'm excited that it may even present opportunities for us as we get through this pandemic for things that we can do better for patients. And really look for ways that we can implement those learnings moving forward in terms of enhancing and leveraging best practice. And finally, I just want to thank everyone again for joining today and being part of this collective effort. It really is a truly collaborative effort.